I think this is an important point to make. Can everybody hear? This shows cancer survival rates in the United States and Europe, between our system and the more socialized systems. I think they'll be more stable than right there. Yeah. So what you see here is, if you're diagnosed with cancer in the United States of America and you're a female patient, you have a 63% chance of survival. That's good. You remember back in the 60s when a friend of ours got diagnosed with cancer? What did you think? It was the long goodbye. Now, so many of our friends, people in churches, synagogue, at business, or in the neighborhood, they beat it, and the odds are you're with. In Europe, the odds are lower, 56% survival. Some of the reason is because drugs like Avastin are not available because of the government-controlled formulary. Also, they dramatically restrict imaging, which is essential in early diagnosis. But sir, the difference is even greater for men. 66% of American men survive cancer. The American man is likely to survive cancer. The European man is not. He still dies. By the way, this is all according to the Lancet, which is the most respected medical journal of Europe in Britain. The reason why so much of this difference is in prostate cancer. It is very lethal in Europe. It is not in the United States anymore. I want to make sure that we all say when pollsters talk about this, they say the American people are interested in two subjects. One, lower the cost of my health insurance, and two, expand coverage for people. And I would say there's one other key question, the quality of health care, which sometimes can be the difference between life and death. Yeah. We want to make sure that
big difference between the 10th and some of the town meetings we've seen, right?
That's right.
By the way, I've lived in the 10th district. I walked by your house. I was older than you on the way to school. Joseph Sears went to New Trier, and other than the Army and whatever, I've lived here, live in Riverwoods now. Talked to Dr. Alexander here. I'm going to see him in less than a year because his office and the technology in my pacemaker has told the nurse that in 14 months it needs to be replaced. That's free enterprise. That's working for you and me. I've enjoyed a very good life. At 38, I got my first one. But my question is, we had a government that tried to jam, cram, and slam a health care bill down the throats of America and get it over before August. We hear very rational people with good ideas. Big business doesn't jam, cram, and slam programs down. Car companies take 4 years to get a new car out. Why do we have to have a program jammed down our throats when we have good people who can do all of this, who can set up a program, who can hold town halls, who can work with the insurance companies, work with the doctors, and put together the reforms that will work? I mean, why do we have to have it so quick all of a sudden?
Well, the reason why... You want the real answer? Yes. The reason why is because the Speaker's bill is losing public support, and they need to pass it before it becomes complete. I just want to say that we did consider, the Senate considered an amendment in the Senate Finance Committee. It said this: you cannot consider the health care bill on the Senate floor until the American people have had 72 hours to read the text. You think that should have passed? That was defeated on a party line vote. And I think that's too bad. Matt, in the red shirt there. Right here.
Couple things. One is the New England Journal of Medicine just published a poll that 2/3, and I guess we've got 2 doctors here, but they must not have responded to this poll. 2/3 of doctors are in favor of the public option. I actually come from a family of doctors, and 2/3 of the doctors in my family also support the public option. I wanted to mention on malpractice. I am in favor of malpractice reform, but I'm not sure that it has a huge impact on medical costs, because in Texas, can I finish?
Yeah, let her speak.
Is there a question?
By the way, we just heard a comment about how well behaved. I want to preserve that because for most of you who live in the 10th Congressional District, you live in the best educated district in the United States.
In my family, it has caused heartache. My father left medical practice earlier, and Jay actually knows my father, earlier, and he was a wonderful person, but he was a wonderful doctor. He left earlier than he would have because he was sued. He prevailed, but he just could not take that sort of thing. So I, more than anybody, would like to see, and my brother has also been sued and he prevailed. But it takes a lot out of a doctor to have to deal with these cases. But why in Texas, where they actually do have malpractice, they've had tort reform, do you have one of the most expensive care markets in the country, McAllen, Texas?
Right. Actually, the medical malpractice rates in Texas have gone down considerably compared to the rest of the United States. But Jay, you had something?
Yeah, I can talk loud. Number one, I responded to that. Number one. Number two is, number one, I said I did respond to the New England Journal survey. Number two is that I never said in this meeting that I'm against government-run healthcare. What I said was, first of all, my actual belief on this whole subject is we're spending way too much time debating public versus private plan. We need a combined public-private plan. Number one. Number two, on the medical liability issue. The state of Texas had an unbelievable problem with workforce. Doctors were leaving the state. And by the way, we're all having a problem with workforce. And that's one thing we do need to invest in. But they were very short on physicians. Since they passed their medical liability reform bill, there has been a dramatic influx of physicians coming into the state, so much so that the state licensure department has had difficulty in getting them all in. So they've actually cured the problem that they had, which was that. The issue of cost and defensive medicine is in part a trust issue. We have medical liability reform in Illinois right now that's sitting in front of the Illinois State Supreme Court that may or may not be found unconstitutional. Right? There is a trust issue on the part of physicians once you pass these things that in fact they're going to be able to practice the kind of medicine they want to practice. And until they develop that trust with their patient, you're not going to see the numbers come down. But if you look at the states that have mature medical liability reform, the prices come down. So over time it will. Texas has been a success, not a failure. It's been a success.
Then why is McAllen?
McAllen is an outlier, and they're looking into McAllen. Now, first of all, one of the things they found is, and it's the same thing as when people say, well, gee, we spent so much in the last year of life. Well, yeah, that's when everybody's sick. Okay, that's not so hard to figure out. Okay, we need to look at McAllen, Texas, and find out if they're an outlier for a reason. Those things do happen. We know that there is total disproportionate use of healthcare resources in this country. The Dartmouth study showed that. That doesn't mean that, the doctors in those places are over-testing. It may mean that there's a reason for it, and we need to look into it. So instead of just saying, okay, so what we're going to do is we're going to reduce reimbursement to those places where they're spending too much money, instead maybe we ought to do a study and find out why.
The border with Mexico might be a clue?
What?
The border with Mexico might be a clue?
I'm sorry, I didn't hear you.
The border with Mexico might be a clue?
Well, except El Paso is local.
I just say also,